Hmm?
In a remote village of Papua New Guinea, a tragedy is unfolding. A baby is sick with pneumonia, and a health worker patrolling nearby has heard of the problem. She finally arrives, walking from the station a few kilometers away.
Morning, you alright? Baby sick, huh? How much week now I'm sick?
This time it may not be too late, although the baby has been sick for quite a while.
The child has pneumonia for the last 6 weeks. Our health center has been closed for a year now. The mother can't take the child to the other health center because it's about 4 to 5 hours walk.
Her health center has been closed for almost a year now. Many health centers in other parts of the country are also closed. Whatever the cause, the consequences are quite serious for the children of Papua New Guinea.
As a result of the closure of these ablution blocks, the health center has turned away inpatient treatment, and as a result, as many as 50 people have already died. We have also turned away children with whooping cough and measles, and they've gone back into the community.
The collapse of rural health services has placed an additional burden on provincial hospitals, which are already overstressed. This has led to a sharp deterioration of health care.
We have a network of facilities throughout the province. Their functional capacity is almost about around 40–50% in terms of manpower and other facilities.
Well, if there was a good primary infrastructure with trained people, I'm sure there would be less cases coming in here, and also they would arrive in much earlier, saying that they will be less sick when they come, and it would be easier for me to take care of them, and the mortality would go down really.
Although the few personnel still operating are struggling to do their best, morale is often low.
So the morale dropped. As a result, the basic health idea also is not practiced, and people themselves also cannot be motivated.
Many other problems compound the difficulty of carrying out health extension efforts properly.
Last December we had a outbreak of measles just because we didn't have enough supplies and vaccines. The fridge we got, it ran out of kerosene, and vaccines were overdue most times, and the cold chain broke down from the carrier to the vaccine just because we had no kerosene.
Measles outbreak long here long last year. Plenty man Mary Christian display special pigrini. 12 pigrini me report come long at post below me long half one he die. Now me took finish medicine problem is up on vaccine. Na supplies long at post na long health center too.
And this wasn't always so.
Now mi bla short lo mersin na plan man meri piginini I kisim sik na big bla bagrabi come up.
In October of 1993, severe earthquakes caused extensive damage in Papua New Guinea. In a matter of days, an immense relief effort was put into action. Millions of kina were allocated to this emergency. This was an excellent demonstration of the country's capacity to cope with its problems. Some 50 people died in that earthquake, and it was a national tragedy. About the same number of children die each day in Papua New Guinea. For them, there is no large mobilization effort, no helicopters, and no army coming to their rescue. Every year, 15,000 children die in this country, the highest mortality rate in the Pacific. 1 of every 22 women die of pregnancy and childbirth complications. One of the highest rates of maternal mortality in the world. The major killing diseases, pneumonia, diarrhea and malaria can be effectively controlled by revitalizing the health infrastructure and supply network. Oral rehydration therapy can prevent death due to diarrhea, and a health and nutrition information campaign can lower malnutrition, which makes children weak and susceptible to infections. With just a few kina per child, our young can be vaccinated against measles, polio, whooping cough, TB, and many, many other deaths can be avoided.
My own adopted son, as an example, a very young, bright little fellow, and I assumed that there was nothing wrong. So I would like to give him some opportunity alongside with my children. But to my surprise, the doctors confirmed that he was struck by measles. And then the next question was whether I could take him to Australia or to some other places where the measles could be treated. But they said could have been prevented if he was taken to the nearby clinic at birth.
Our children continue to die every day. About 50 children die daily. The common killer diseases are pneumonia, diarrhea, malnutrition, malaria, tuberculosis. What we need is social mobilization of resources to help these children. And we must act now immediately to combat these problems.
And we leaders, I feel that we have got moral obligation that some of our national revenue should be set aside and targeted towards the welfare of young people. If we don't do it, who else will do?
The health of our mothers and children is in a state of crisis. The conventional health methods are simply not working in this area. If we don't act now, the situation will deteriorate. We can act now, but we must get across to our community, mobilize them, and this calls for a crash program.
The Child Survival Crash Program is a concentrated national mobilization to improve the health of children and mothers, and focuses on achieving the international mid-decade goals for children. It is a multi-level approach to re-establish a sound health network throughout the rural areas of Papua New Guinea. First, it is training an army of health workers, not just to deliver health services, but to become agents of change. These health workers will be mobilized to deliver knowledge about health and to change the community's child care behavior. Second, these health workers will go house to house to empower rural mothers with life-saving knowledge about preventive health. Because of low literacy and low access to information, only face-to-face training can change behavior and their ability to prevent diseases. Third, health facilities around the country must be revitalized and made functional. Once carefully assessed, the proper equipment and supplies must be provided. Sterilizers, scales, and vaccine carriers, as well as medicines. Fourth, mobile MCH patrols providing basic health care for the rural population must get back on the road. Until an alternative is in place, this critical service must be given higher priority by all levels of government. They are the front line in the battle for child survival. Fifth, all levels of government, all sectors will join together to support and give priority to this program. Visible, high-level political leadership, fundraising, multi-sectoral assistance, and community participation will be essential, as well as constant support and attention from the mass media. The Child Survival Crash Program is more than just another development plan. It will safeguard the investment we have in our children, the inheritors of our nation. To become a productive and self-reliant country, we must have a true commitment from each and every one of us. Nothing less will change the course of events that are taking away thousands of our sons and daughters every year. Papua New Guinea is a young country with a bright future. This is the time to make this program a success and place this tragedy into our past.